The most rewarding aspect of being a physician or a spine surgeon for me is the human interaction. And I think particularly here, having grown up in Alaska and brought a relatively sophisticated type of practice to a rural area, people are thankful, not so much for you directly, but for the fact they don't have to travel. They can recover with their families. I also, from a personal point of view, grew up fishing and building cabins, and so the stuff people do here I feel very natural talking to people about, because I'm mad if the king run is bad, or I'm happy if the silver run is good, and it's fun to talk about that. So when they can go back to the things they love, it makes me happy because it's the same things that I love usually. Minimally invasive spine surgery for the patient is probably the biggest thing, is it's usually less painful and they recover quicker. So from a point of view of going back to work sooner, being able to participate in family activities sooner, and just their own component of pain is a lot better. How do we reassure patients? And patients are often potentially more nervous about spine surgery than many other surgeries. Reassurance for me is just being honest. There is no real shortcut with it. So I think you just have to be straightforward. I don't know just how you'd tell a family member, or if you were, or if you wanted someone to tell you, how would you do that? It's a very caring way. You have to make sure you've treated patients in every other possible way, because most people don't want surgery as their first choice, including me. And it's taking time with a patient, having multiple visits, so that you understand them, they understand you, and they have time to process it, so that you can talk on different occasions after they've thought about it and gone through the emotional parts of it. The things that took me to biology were growing up here, spending time in the outdoors here and experiencing that made science easier for me. And I excelled in those things because of my youth here. So coming home is, I don't know, like I'm a salmon in a way, but and I think spending the time in Chicago and Boston and overseas gave me a unique set of skills that I'm happy to be able to bring back to the state, and be able to give that, because the state has given my family and me so much. It just feels like a normal fit. I go to Kenya probably because of my parents. My mom worked with the native population. She was a second grade teacher who, in the last 10 years of her career, had got a federal grant to work with native kids, because they would get behind, due to some of the differences between the villages, and when they ended up in Anchorage, and when they get behind, they had a higher dropout rate. So the goal was to keep them caught up during their transition period so they could excel, and they do. It's crazy to watch. So I was the Easter Bunny, I was Santa Claus, I was helping decorate the classrooms as a kid. And I just saw that kind of give back. So my initial thought about medicine was coming back and being a float plane pilot and being a family practitioner and working in the small villages. And as I went through medicine, I worked at the Shriners Children's Hospital and ultimately got into spine, and then started to be able to visit a lot of third world countries that have huge needs. And I just ended up in Kenya with a friend, and we developed a program there that teaches spine to Kenyan doctors and African doctors so that they can continue to do that.